There's no doubt that this is a Missouri solution to the problems created by Obamacare. The Affordable Care Act, first of all, created a fundamentally unfair gap in coverage. If you are under 18% of poverty, you're currently on the state Medicaid system. If you're between 138% and 300%, the federal government, now under the Affordable Care Act, gives you subsidies to help you buy health insurance. But in Missouri, if you're between 19 and 138, you have no help, but you're still required by the federal mandate to have insurance. That's a fundamentally unfair situation that the federal government has placed our citizens in. So that's something that needs to be addressed. And the way that they had envisioned it being addressed is that we would just dump them all into Medicaid. Well, again, just putting them in Medicaid is financially unsustainable, and it's not smart because we have problems with Medicaid. So the first thing I did was create a budget protection fund. Basically, take cost savings that are realized in the early years of shifting people from a 60-40 match that we have today to the 100% match, which steps down to 90-10. That accrues several $100 million over the next few years that we can set aside for when we begin to pay the match. At the end of that, we wanted a backstop, make sure that if there wasn't enough money in the fund, that we could still protect the taxpayers. So we put a mechanism in there that if the fund doesn't cover the cost of the new enrollees, that we would then adjust the provider reimbursement rates and essentially make the providers pay the state's portion of the match as opposed to making the taxpayers pay for it. So that's the first part. The second part is, what do we do with these new people? Clearly you can't funnel them into a broken system. So we've wanted to expand managed care statewide for a certain part of the population. For anyone over 100% of poverty, we want to put them into the private insurance market, which is similar to plans in Iowa, Arkansas, Pennsylvania, Indiana, and others. So that's the second piece. And then the third piece is entitlement reform. Clearly I'm not interested in just expanding the welfare state here in Missouri. So any way that we can attack the problem of trying to get people to participate in the workforce and not just take from the government, I think is a good thing. So we've got some reforms in there for the TANF program and the SNAP program to try and help people get back to work. What we're wanting to do is not what the federal government wants us to do under the Affordable Care Act. And so by virtue of us seeking a waiver and creating our own plan, that this is something that we have generated, not the federal government. For businesses, the infusion of the federal money obviously would help the economy. I mean, that money doesn't just materialize on a spreadsheet. It actually gets spent through the healthcare providers, who then potentially would hire more people if they have a need, or would return more tax revenue, for instance. So there's certainly that aspect. And then the reform aspects of the TANF and SNAP program would hopefully encourage more participation in the workforce, which for businesses hopefully increases the pool of applicants, of people to fill the jobs that they may have. The whole reason I ran for office years ago is because I feel like our government needs to solve problems. I feel that we need to tackle the big issues. And over the years, I've grown increasingly frustrated with those who won't tackle those problems and instead just want to stand on sound bites, And I've learned it's easy to give speeches and it's hard to govern. And I'm hopeful that we can get more of my colleagues into the governing side of things.